today on an all-new Dr. Phil.
Carrie will do anything to get pain pills.
She actually caused an accident so she could get more drugs.
From PTA mom.
You've gone to school high, been around these kids high.
To addict.
You bring heroin into my home?
Living in her luxury car.
My husband told me to get the hell out of the house.
You stealing my money? You're physically violent?
You gave up on me. You've told me I wish you were dead.
Let's do it.
Have a good show, everybody. Here we go.
This is a safe place to talk about hard things.
Stand by. We'll count you down.
Today's going to be a changing day in your life.
5, 4.
I am not giving up on you. All right, this is Carrie, who says she was a well-respected PTA mom and a proud mother of 3. All athletes, her youngest a high school scholar. So how does a prominent soccer mom go from driving her daughter to the big game and leaving the stands to get high in the school bathroom to flatlining twice and landing in a 9-day coma? Well, her husband Christopher and her oldest daughter Samantha claim Carrie's downward spiral started with a prescription, a legitimate prescription for pain pills after suffering a series of medical problems. Now, Christopher says Carrie will do anything to get pills, including purposely crashing her car to score a trip to the ER so she could get more drugs.
Carrie's addiction to pain pills has destroyed this family. The worst part about it is she takes no accountability for it. She always thinks that she's the victim.
She totally brushes off her own part in all of it. Like, she doesn't care.
I know for a fact that Carrie has driven the children around under the influence of some kind of drug.
While I was in middle school, my mother disappeared for over a month.
She never left a note, never told me where she was going, never contacted the children. She just dropped off the face of the earth.
Later, I found out she was in a hotel using drugs.
We found all kinds of hypodermic needles. She weighed 95 pounds. This is crazy.
In November, my mother and I got into a physical fight. The police were called, and she was handcuffed and taken to jail. After she was arrested, she was taken to the hospital, and we found out she was on life support. I felt like it was my fault.
Carrie was loaded the day she returned home from the hospital and never changed since then. Through the frustration, I wanted Carrie dead. The attorneys that I consulted said that it sounds to me like she's probably going to pass one of these days soon. It was suggested to me that I just wait it out. I'm still waiting.
You read the headlines every day of yet another overdose due to an opioid addiction, but what you don't know is that you or someone you love may be at risk and not even know it. That's why I'm talking to you right now. With nearly 2 million addicted, including children as young as 13 years old, opioid addiction has become a red alert crisis in our country.
Deaths from prescription painkillers have more than quadrupled since 1999.
More than 1,000 people are treated in emergency rooms every day for misusing prescription opioids.
The rise in opioid-related deaths is pushing local morgues to capacity. The opioid pain pills, OxyContin, oxycodone, Percocet, Vicodin, fentanyl, too often were being prescribed for people with back pain, arthritis, or other chronic pain conditions. When it was time to wean them off, many patients were helplessly addicted. 91 Americans die every day from an opioid overdose, according to the CDC.
Since 1999, the number of prescriptions sold for the highly addictive painkillers has quadrupled, and so have the number of people who have died from them.
Many clinicians have overestimated the safety of these products and underestimated their risk.
In 2010, doctors and pharmacists gave out enough opiate painkillers to medicate every American adult around the clock for a month.
Dr. Caleb Alexander has studied if doctors are becoming more cautious when prescribing the drugs.
Although there is some evidence that doctors are scaling back a little bit, we have a long way to go.
I have to tell you, it sounds awfully cold to me to say, well, I could get a divorce, or I could get her help, or I just wait and she'll just die, and that'll fix my problem.
Well,
and damn it, she just won't die.
Well, it wasn't that it would fix the problem. Carrie would always threaten me with taking half of the possessions. And, you know, my primary thing was always to try to keep the mother in the children's life, no matter, I guess, at what cost. But in the end, you know, I failed miserably. Every attempt that I made, I failed at in trying to somehow keep Carrie clean.
She made this really tough. I mean, she actually got on the freeway, caused an accident so she could get more drugs, right?
Those were her words to me exactly.
She's actually attacked you.
She just went crazy, drop kicking me in my stomach. I had to physically hold her down while my 4-year-old was hitting her and screaming, "Get off of my mom."
This has had a lasting effect on you.
She's a great mother when she's clean. She loves her kids, does all the right things. And
she was doctor hopping, right? 8, 10 doctors at a time?
From what I can tell and from the documents that I have seen and knowing. I mean, I've been to several of her doctors in the past to
And you intercepted some shipments that were coming to the house. How many pills did you intercept?
They were bags that probably contained as many as 500 pills on 2 different times, and I flushed them down the toilet. Carrie went absolutely berserk. A lot of this stuff I don't know, but I'm going to hear things today that I know that I've heard for the first time, even in spite of what I've witnessed, and that just, it kills me. It kills me.
I'm afraid that's going to be true. Now, before we meet Carrie, I want to tell you I have brought in some serious reinforcements today. These 3 doctors are the top minds. I'm talking about heavy hitters, the most respected in their fields. They're also my colleagues. They're also my dear friends. Dr. Gerald Sachs is the Director of Pain Management at the Pain Institute of Santa Monica in California. He was trained in anesthesiology and critical care at the University of Chicago and completed his training in pain management at Harvard Medical School. So please welcome Dr. Gerald Sachs. Dr. Sachs, please say hello. Dr. Patrick Johnson is director of the Cedars-Sinai Spine Center in Los Angeles, California. Dr. Johnson is a dear friend of mine. He's also professor of neurosurgery at UC Davis Medical Center, as well as the director of the California Association of Neurological Surgeons. So, Dr. Johnson, thank you for being here. Another colleague and dear friend of mine, Dr. Charles Sophie, is board certified in 3 clinical specialties: adult psychiatry, child and adolescent psychiatry, and family practice, as well as being the medical director for DCFS here in Los Angeles, which is the 2nd largest DCFS program in the United States. Dr. Sophie, thank you for being here. So, gentlemen, this is epidemic proportions in America, correct?
Absolutely.
Yep. And is this, I get the feeling that so many of our viewers think because they might acquire these pills with a prescription, that means it's okay. Dr. Sachs, if they're taking these things for extended periods of time, it's changing who they are medically, biochemically, in every way.
Absolutely. These patients get their prescriptions, at least initially, usually for an appropriate reason. And then commonly they'll just continue to take these medications far beyond the period of which time that their pain was occurring.
Well, isn't it true that if you take these things long enough, they actually make you hypersensitive to pain?
What I believe you're referring to is something called opioid-induced hyperalgesia, which occurs in some patients where they take the opioid, and paradoxically, it actually makes the pain worse, and that does occur as well.
Dr. Johnson, what would be a normal course of taking opioids for pain?
It's usually just the first week. So a surgical problem is something that can be resolved with their postoperative pain management. And after a week or 10 days and maybe 2 weeks, I think that it's unusual when somebody needs surgical postoperative pain management for 4 weeks.
Now, Carrie says her pain pill addiction led to making horrible decisions, but she also claims they turned her into an energetic PTA supermom. Did they really? We're going to meet her after the break.
When I had to get up and drive my daughter to school, I've been on pills. When my children had school events, I would take my pills. The pills would give me a boost. I've been a great mom.
And later,
you don't listen to anybody. You're physically violent. You're a predator. You bring heroin into my home.
You gave up on me. You gave up on your family.
It's a plague infecting our families, towns, and schools. It can start as simply as a doctor prescribing medicine to relieve a pulled muscle, and before you know it, you could become one of the 91 Americans who die every day from a pain pill addiction. Now, Carrie says she's one of those people. She just hasn't died yet. Well, actually, she has twice, and they've revived her. She claims her husband's lack of compassion for her struggle has been the hardest pill for her to swallow.
Well, I blame the doctors for my being an addict. Pain pills, they constantly prescribed all kinds of medications, the addictive ones, without ever educating me. Over the years, I had several medical conditions, congestive heart failure. I had a stroke. I had pericarditis, severe infection around the lining of the heart. I was prescribed all these pain medicines, Vicodins, oxycodones, and I eventually became reliant upon them. I would be physically sick if I didn't take them. In 2016, I went into cardiac arrest and died. They performed CPR. They shocked me twice. A couple of my ribs were cracked. The fighting started immediately the day I got home. Chris accused me of being loaded again, and a terrible mom, and a quitter. The 7 weeks I was in the hospital and still on pain meds, he has not been a supportive partner at all. There were times I begged him to hold my meds. Chris wouldn't do it. His opinion is that I'm just a addict, that I've always been getting loaded. All my health issues are my fault. I should go die. They'd be better off without me. If I had a partner who was at least willing to show some compassion and understanding for what I've had to go through, I wouldn't have used them.
But Carrie says there was an upside to the pills. They gave her the energy, she says, to become a super mom to her children.
I've been a great mom, selfless, hardworking, loving, and compassionate. I tried to be a super mom. I had to maintain the big household, do all the chores, all the kids' activities. I was in the school districts volunteering. The pills would give me a boost, that spunk of energy. Oxycodone was my pill of choice. They're potent, small, easy to hide. The last 4.5 years, I've been on them every day. When I had to get up and drive my daughter to school, I've been on pills. When I had late nights doing homework or sport activities or a big dinner, I've been on pills. When my children had school events, I would go in the bathroom, take my pills. At home, my children's friends and their families, they didn't see this out-of-control addict who was a bad mother. They trusted me, and I just let the facade continue. That I was this great mother and protector of everyone's children. I didn't know how to stop. A voice comes out that just wants more. When I would try to cut back, I would get sick again. So these are my Subutex and Trazodone. Tramadol here is for pain. And to my surprise, they don't show up as an opiate on my drug screening urinalysis. Nobody knows. I'm still using. I'm still medicated. I'm still lying. I still feel like I'm a fake.
You've gone down a long and difficult road that's put your health in jeopardy, put your life in jeopardy, put your family in jeopardy, and you're still using. Do you have an inability to stop?
I'm completely willing. Absolutely.
You've been very creative in getting pain meds. What have you done to get this addiction under control?
I've paid myself for 3 or 4 private treatment centers in the last 18 years. And they always put me back on the Suboxone. A lot of the doctors don't want the liability, I don't know, of getting me fully off of them. And
so you're just a victim here.
No, I'm not a victim.
Well, you say you're a victim of the doctors, you're a victim of the treatment centers, you're a victim of people not wanting to take responsibility or liability for you. You're just telling me you're a victim.
I'm saying that in some cases I've been a victim, in some cases I've hurt myself. And a lot of it was me going through these difficult health issues, and the medicines definitely altered who I was and what I wanted, and you know that. And I have so much remorse, and I will try to make that up to you the best I can for the rest of my life. Who put you on heroin? I did.
You have attacked your daughter in front of her children. That you have crashed your car on the freeway, that you've come up with every excuse to get in the ER. You're not talking about any of that. You're just talking about the doctors that have over-medicated you.
No, all of that is true. Once the drugs are in my body, I'm a different person. And that's the catch, is trying to live without them when physically there's times I've needed them, and finding alternatives. And that's...
Well, I'm beginning to understand why you haven't responded to treatment, because you don't want to own anything. You want to blame everything.
Maybe.
Carrie says once the refills started running out and the withdrawal started creeping in, she turned to heroin, even using in the school bathroom. We'll talk more about that when we come back.
When I was with my daughter at her school, I would use heroin in my car, or just go in the bathroom and then go back into the classroom, help the teachers, interact, talk, smile, laugh, hug the kids. Oh, hi.
And later, you don't sit there and say, well, damn, she didn't die this time.
But I didn't want her to die, Senator.
Yeah, I wish she were dead. I gave them the audio.
At times, you're absolutely right, Terry.
In May, my husband, Chris, told me I was a piece of... told me to get the hell out of the house. After I left, I was living in my car.
So this is my $80,000 BMW. Little did I know I would be living in it. I slept in the back seat behind me.
When I left the house, I was wearing my life vest, the heart defibrillators. I would go into Starbucks, spend 4 or 5 hours there charging my life vest, so that night I could make sure if my heart stopped that the life vest would work.
This is my life right here. Everything I have to my name. This is all I have. This is my bottom.
Well, Christopher says he kicked Carrie out of the house a few months ago, and she has been couch surfing and living in her car ever since. She said she never imagined she would be homeless, but she also never imagined she would be using heroin.
I started doing heroin. It was more cost effective, and pain pills are godly expensive. Heroin is a quarter of the cost. In the beginning, I smoked it and I plugged it. To plug heroin is to mix it with water, and with a soft syringe, you insert it in the rectum. The intestines absorb the drugs, and then it gets in the bloodstream that way. I would use heroin 6, 7, 8 times a day. When I was with my daughter at her school, I would go out in my car or just go in the bathroom, and I would lay down on disgusting bathroom floors and insert it, and then go back into the classroom, help the teachers, interact, talk, smile, laugh, hug the kids. Oh, hi. I used in people's houses, even at church in the parking lot, and before I would go in. I transitioned from plugging the heroin to shooting up. The guy that I was buying it from would do it for me. It was a quicker, more potent rush. Within 5 months, I spent well over $30,000. I stole some money from Chris, $3,000, $4,000. And one day when I opened the safe, the money was gone. He was on to me. I used heroin for about 5 or 6 months until the cardiac arrest. I went from 25 years volunteering in the schools, being on the PTA, to getting addicted to the prescriptions and turning to heroin. I taught my kids to follow the rules in life. The same parent they're trusting and listening to is going in the bathroom doing heroin. It made no sense.
Well, I will tell you, you didn't invent this problem, because 80% of heroin addicts abuse pain pills before they turn to heroin.
That's why I'm here.
In the first 4 weeks of being on heroin, you spent $20,000, you say. And this comes from overusing pain pills to begin with.
Yeah.
You acknowledge you've driven your children high. You've gone to school high. You've been around these kids high. You've done everything high. This was your supermom high.
I lived my life like it was my life that I had before the heart infections and the weeks in the hospital on ventilators, going home drugged up. I had to go back to my life. He didn't help me. He was gone day and night, every weekend, doing what he wanted. You do what you have to do. I didn't.
But you knew she was high, right?
Oh, yes.
All the time.
So how could you let her drive your daughter around knowing she was high?
I have to take responsibility for that. She wouldn't listen to her doctors. Oh my God. Okay, you don't listen to anybody. You stealing my money. You're physically violent. You're a predator. You attack. You don't know what timeout means. And enough is enough. You bring heroin into my home.
And I'm sorry.
Yeah. You're
but
sorry.
You left the home and worked.
I never left the home.
For
you
20
left
years
the home.
and
I have been here every night for these kids.
So
every night. Where were you when we're out shooting dope?
Who got their groceries? Who cleaned the house?
I guess I did, Carrie. Where were you?
With heart failure and infections.
This is all we do. This is our relationship for the last
me with the pain.
15 years.
I couldn't stay a mother because you had to work.
Carrie, after you...
What did you expect from me?
After you were gone for 2 months shooting dope and everything, and we all know this happened, nobody knew where you were, your sister got you into your first long-term treatment centers. You were clean. You still had all these illnesses.
That was 20 years ago. You gave up on me. You gave up on your family. Yes.
I've never given up on my family. Carrie, I have never given up on my family. That's why I'm here today.
Dr. Sophie, what level of narcissism and denial are we dealing with when she is here defending everything that's going on?
You're very entitled. You don't really want to own anything.
We just had a little microcosm exchange here in front of this adult child, but if you had known about this situation when it was happening, would you have taken these children out of the home?
In a heartbeat.
Yeah, absolutely. Yeah.
Next, at just 15 years old, authorities removed Samantha from Carrie's care. So did she fight to bring her daughter home? We're going to find out what she did do after the break. But you can at least be enough of a human being to look this child of yours in the eye and say, I am sorry what I did to you. You didn't deserve it. I did it. No excuse. I am sorry. Closed captioning provided by... Carrie is one of the 2 million addicts who were prescribed pain pills by their doctors. Now, Carrie's daughter, Samantha, lived with that addiction. She says her mother's refusal to acknowledge her violent behavior toward her growing up is just one in a litany of offenses that she says she just cannot forgive her for.
My mother's pain addiction caused her to be very violent with me as a child. She would push me, pull my hair, smack me, and hit my head, kick me. I remember the look in her eyes. Evil, scary. She looked like she hated me. She did not look like my mom. I would tell her that I hate her, and she would tell me she hated me back. When I was 15, I remember I went to run away, and she chased me outside. She shoved my face in the snow on the stairs, and I started screaming. One time, on the way home from basketball practice, she was mad at me, and she grabbed my face and hid it in the center console of the car. I jumped out of the car when it was moving and ran to a stranger's house, and they called the police. CPS got involved, and I have not lived at home since I was 15. My mom has never taken responsibility for the stuff she's put me through. I know part of my depression is due to things that happened to me when I was younger. If my mom would acknowledge the abuse, it would be the biggest breakthrough for me.
What do you say about that?
It's heartbreaking.
Will you stand up, please? Will you stand up, please? I want you to look her in the eye. Now, not even God can change what has happened, but you can at least be enough of a human being to look this child of yours in the eye and say, I am sorry what I did to you. You didn't deserve it. I did it. No excuse. I am sorry. You didn't deserve that.
You didn't. Sorry. You were just a kid. You didn't deserve it.
You're not delusional. It did happen, and I am sorry. No excuse. I am sorry. Look her in the eye.
No excuses. I'm sorry. You were just a child. It wasn't your fault.
I haven't seen you try for a long time.
How about we'll see?
Yeah, we'll see, Mom. I hope so.
I'll keep an open mind and we'll see.
I'll keep an open mind and we'll see.
Thank you. Ready.
When we come back, Samantha and her brother Nathan claim that Christopher is not innocent in all of this and claim his lack of compassion and treatment of their mother has contributed to her addiction. We'll talk about that and add Nathan to the conversation after the break.
Yeah, it's a cold thing to think that you want somebody to die, but it was never about the money. It was to provide relief. I just wanted it to go away, and there was no way that I could get rid of it except for her to expire.
Closed captioning provided by...
My mom and I used to be really close. We used to have like a really special bond. Things changed when she started doing drugs. I'm very scared of her when she's on drugs. She's out of control. One time she kicked the door and it fell on my brother's head and he started bleeding. She's thrown stuff at my dad. I'm not comfortable around her. I just sit in my room. It's scary. She's broken my trust.
That was Carrie's youngest daughter, Maya, who says she's not only doesn't trust her mother, she's actually afraid of her. Now, Maya's older siblings, Nathan and Samantha, worry that Christopher's hatred of their mother may be contributing to her addiction and clouding their little sister's opinion of Carrie as well.
I believe that my father and my mother's relationship has been abusive, and my stepfather has played a huge role in my mother's addiction.
My dad says stuff about my mom like he wishes she would die and that he wouldn't care if he never saw her again.
My father has said things about my mother that were not appropriate. He will vent to just about anyone he can, including my little sister.
I think my sister is being manipulated by my dad. She's innocent and naive, and I feel like my dad has put a lot in her head. My sister is 15 years old. She needs a mom.
Nathan, thank you for being here. I'm sorry that you need to, and I'm sorry that the subject matter is what it is. You've been listening to everything so far.
Yes.
What do you want to add?
Well, I want to start with, is it true that you stole Chris's money, like you said in the video?
Yes.
It is. Okay, then I am sorry. I'm
sorry too, Nathan. Can I clarify one thing here? Yeah, it's a cold thing to think that you want somebody to die, but it was never about the money. It was to provide relief. This has been a family in crisis for 15 years. I just wanted it to go away, and there was no way that I could get rid of it except for her to expire.
You either become part of the solution and continue to work towards a return to health, or you get your stuff and your children or whatever and you leave. But you don't sit there and wait and hope that the mother of your children dies. That's not a solution. You don't sit there and say, well, damn, she didn't die this time, maybe next time.
But I didn't want her to die. through 3 long-term treatment
You
centers.
told me I wish you were dead. I gave them the
I
audio.
did. At
You always
times,
tell me
you're
that.
absolutely right, Carrie. You're absolutely right.
Then
The
why did you
pain
just say no?
was so much. I don't know where to go. Like
Chris.
I said in my tape, this is a last hope.
Chris.
I don't know.
Chris.
I will own my part, sir. I will own my part, and I have to.
I totally get your frustration. It is unbecoming to you to sit before your children and say, well, one good solution would be if she would just expire and then the problem would be over. You don't want that heat, my friend.
I know
Trust
that.
me.
I know that.
So you need to take that concept out of your vocabulary. She is entitled, she is arrogant, she is belligerent, and she lacks insight. She is easy to give up on. But we're not going to do that. Not that you make it easy. Next, so where do we go from here? I'm going to tell her what I think after the break. Carrie admits she's been struggling with a pill addiction that began with a simple doctor's prescription. Dr. Sophie, would you come up here and help me for just a minute? Because people sometimes think that an addiction is psychological.
Correct.
But we're not talking about a psychological addiction here. No. We're talking about an addiction that affects a number of structures. It affects the frontal lobe, correct?
Yes.
How so?
Well, any drug that you're putting in your body is changing the chemistry of your brain, which will affect parts of your brain. Frontal lobe is the part that does executive functioning, judgment, insight, impulse control.
Okay, so when these opioids are, and heroin as well, are taken, it changes the efficiency with which you perform cognitive functions. The cerebellum, which involves coordination. This is where she's driving the kids around. It impacts the nucleus accumbens here, which are the pleasure centers, right?
Correct, yes.
And once these brain structures are changed, they're recoded, right?
Absolutely. They don't go back to the way they ever were.
This gets into the limbic system, the basal functions of the brain, which involve the thalamus, the hippocampus, the parts of the brain that involve the emotions, the reasoning, the motivation. All of these things are changed.
They go right out the window.
Do you get what you've done to yourself here? You haven't done this for a week or a month. You've done this for years. When you try to stop and fail, I don't ask myself why you fail. I ask myself why not, because you're not dealing with this at the basal level of the brain. That's what people don't get.
This is amazing to hear, because I started just believing I was screwed up.
Oh, you are. It's just a matter of why.
Why?
It's just a matter of why you're in that situation. Dr. Johnson, I don't want people, I want to put people on red alert here, but I don't want people to be afraid to take appropriate pain medications when they need them. And I don't want to embarrass Dr. Johnson, but I think he is widely renowned as the finest spinal surgeon in America. He's certainly who I chose to operate on my spine. And the pain was minimal because it was very well done. But if it's needed short term, it's okay to take these, right?
It certainly is. There's not a problem taking them short term. It's really what happens is, Dr. Sophie said, those basal parts of the brain, they have a reprogramming. But you know what? Those big yellow parts, that's what we think with. I listened to Carrie, and I think this might be her new excuse. Okay, it's the basal parts of my brain are going to be reprogrammed. Oh, now I can go back to that. That's going to be her next excuse. Mm-hmm. But it's what's up here. It's in those big yellow parts.
And if you do have a chronic syndrome, Dr. Sachs is a pain specialist, and I've had some pretty serious injuries, and you manage that across time. But my God, you had a matrix set up. It was, you and Nurse Robin back here, Seriously, he had a matrix.
Was key.
Yes.
Make sure you knew that.
No question about it. This has to be done very, very carefully if it's a long-term situation, right?
That's correct. Also, the modern understanding is that addiction actually is what we call a biopsychosocial disease, and people have a genetic predilection to get into trouble with these sort of medications. It's far more difficult for you to control it, to decrease your medication use, and to get off these medications at the appropriate time.
I want to talk about this very seriously because the Origins Behavioral Health Care, which I consider to be the nation's leading dual diagnosis treatment center, has offered to extend their resources to you. And I want to tell you what that means. What's special about Origins is that they now have what they call the Lawless Opioid Protocol, which is a specialized 4-stage recovery process for opioid addiction, and it has been created by Dr. Lawless, who is the chairman of the Dr. Phil Advisory Board. I have nothing to do with the program. I don't benefit from it in any way. I have no involvement or investment in it, other than I have great confidence in Origins. I have great confidence in Dr. Lawless. It is a serious commitment to changing your life and doing this right one time. But I get one phone call that you're playing the diva card and you're going to be sitting out on the curb. So you need to think about that, and we'll be right back. Closed captioning provided by... I want you to look me in the eye and tell me whether you're up for this and willing to do this or not.
Absolutely. Absolutely.
I want to leave us with this summary. There's an estimated 2 million Americans, 12 or older, that are addicted to prescription pain relievers. 300 million annual opioid prescriptions are written. Annual opioid prescriptions equal every American adult could have their own bottle with what's currently being written. 276,000 adolescent non-medical users. And get this, if you have an opioid prescription and you refill it one time, 1 in 7 people will be addicted at 1 year. The chance of addiction increases after the 3rd day that you are prescribed. 60% of overdose deaths involve opioids. 91 Americans every day die from an opioid overdose. 84% higher risk of atrial fibrillation, and women addicted increased more than 400% from 1999 to 2010. And fatally injured drivers who tested positive for opioids rose 700% from 1995 to 2015, and you're 40 times more likely to be addicted to heroin if you have abused opioids. Nearly 80% using heroin misused prescription opioids before they did heroin.
I didn't grow up or raise my kids or think I want to be a junkie. I live in a middle-class suburban area. My kids go to great schools. I've participated. These prescriptions are scary, and they're not things that you should get on and be on alone, and that's what I've done. And then I've lost control. This can happen to anybody.
It happened to you. You got to clean your own house. I want to thank all of my guests today. A special thanks to Dr. Frank Lawless and Origins Behavioral Health Care for offering resources to Carrie, and to Dr. Lawless for his opioid protocol. I especially want to thank Dr. Gerald Sachs, Dr. Patrick Johnson, and Dr. Charles Sophie for being here today. We will have links to all 3 of these gentlemen. Should you want to know more about them and their practices, you can see it on drphil.com. We'll see you next time. This is